Let's talk about anorexia nervosa. You've probably heard the term, right? But what most people think it is, well, it's not even close. This isn't just about dieting or wanting to be thin. We're going to dive deep into what this really is, a serious, complex, and frankly, dangerous psychiatric illness.
Okay, let's just get this out on the table right away. This quote says it all. Anorexia nervosa is one of the most lethal psychiatric conditions. That hits hard, doesn't it? It immediately tells us we're not talking about a lifestyle choice here. This is a life or death situation.
And to put a number on that, a really scary number. The mortality rate for someone with anorexia is a staggering 6 times higher than their peers. And that lethality, it comes from two places: the brutal physical damage from starvation and, tragically, from suicide.
So, to really understand what's going on, we have to look past the physical stuff. We need to go inside the mind. What does it actually feel like to have anorexia? Let's explore that.
All right, so if you look at the official diagnostic manual, the DSM-5, it boils anorexia down to 3 core features. First, there's restricting food so much that it leads to a seriously low body weight. Second, there's this intense, all-consuming fear of gaining weight. And third, and this is a big one, there's a really disturbed way of seeing your own body.
And you know, these core features don't just pop up out of nowhere. They often grow from a specific set of psychological traits. We're talking about really high levels of anxiety, an extreme kind of perfectionism, obsessive thoughts that just loop over and over about food and weight, and this powerful, desperate need for control. Eating becomes the one thing they feel they can control when everything else feels chaotic. This is where things get really counterintuitive and honestly so tragic. There's this quote that just nails it. As the person loses weight, they feel bigger and bigger. Can you imagine that? The more weight they lose, the bigger they feel. It's this profound distortion. It shows you that there's no thin enough goal they can reach because the problem isn't actually in the mirror. It's a feeling, a deep internal state of never being okay. You know, this is a super common misconception. The word anorexia literally means loss of appetite, but well, it's just wrong. People with this illness often feel intense hunger. They're starving. The problem is the fear, the anxiety, the compulsion to restrict, it's just stronger. It literally overrides the body's most basic survival instinct to eat.
So the big question is, where does something this complex even come from? Well, there's no single, easy answer. It's not just one thing. We really have to zoom out and look at this whole web of different factors that all come together.
Yeah, the way experts think about it now is that anorexia is a multifactorial illness. That's just a fancy way of saying it has biological, psychological, and social roots. Think of it like a perfect storm, where your genetics, your own personal psychology, and the culture you live in all collide. And this is where it gets really fascinating. Check out this chart. It's from twin studies, and it shows what causes the differences or variance in who gets anorexia. And look at that huge slice of the pie. Genetics. It accounts for 50 to 80%. That's massive. The next biggest piece is unique environmental things, like a personal trauma. And what's really surprising? The smallest piece is the shared cultural stuff that so many people think is the main cause. This points to a really powerful biological predisposition. But that's not to say the environment doesn't matter. It absolutely does. It's often the trigger for that genetic vulnerability. So what are the key risk factors? Well, it's much more common in females, and it typically starts during adolescence. We also see it more in developed, industrialized nations. You know, places where there's this relentless cultural pressure to be thin. Okay, so we've talked about the mind. Now let's turn to the body. Because this constant mental battle, it wages an absolutely devastating war on a person's physical health. Let's take a look at what prolonged starvation actually does to the body. When the body is deprived of energy, it has to make some brutal choices to survive. It starts to break down its own tissues. The heart rate can slow down to dangerously low levels. That's called bradycardia. Bones lose their density and become incredibly brittle, leading to osteoporosis. The kidneys can start to fail from dehydration. The body can even grow this fine, downy hair called lanigo all over in a desperate attempt just to stay warm. And the danger isn't just from the body shutting down. The psychological pain is just so immense that up to 20% of all deaths from anorexia are from suicide. Okay, let's clear something up that a lot of people get confused about: anorexia versus bulimia. They might seem similar, and some behaviors can overlap, but there's one key clinical difference, and it all comes down to body weight. By definition, a person with anorexia is significantly underweight. Someone with bulimia, on the other hand, is typically a normal weight, or sometimes even a higher weight. Now, after all of that, it can sound incredibly bleak, but I want to be really clear. Recovery is absolutely possible. It's a long, tough road for sure, but there is a path forward, and modern treatment offers real hope. So what does that treatment look like? Well, it's not just one thing. It really takes a whole team of specialists. The very first step is medical stabilization. You have to deal with any immediate health emergencies. Then comes nutritional rehabilitation, which is all about safely and gradually restoring weight. And at the same time, there's intensive psychological therapy to get at the root thoughts and behaviors driving the illness. So what about medication? Does it help? Well, yes, but it's a tool, not a cure-all. Some drugs, like the antipsychotic olanzapine, can actually help quiet down those obsessive thoughts and make it a bit easier to gain weight. But what's really interesting is that standard antidepressants, like fluoxetine, usually don't work when someone is at a very low weight. And that's probably because the brain just isn't functioning properly without enough nutrition. Now, once weight is restored, those same medications can be super helpful in preventing a relapse. So what does the prognosis look like in the long run? This chart gives us a pretty good idea. With the right kind of treatment, about half of people achieve a good outcome, which is amazing. Around 30% have what's called an intermediate outcome. They're doing better, but some symptoms might stick around. And unfortunately, about 20% have a poor, more chronic outcome. And what that really tells us is how crucial it is to get help and get it early. When you boil it all down, anorexia really reveals this profound, painful disconnect between the mind and the body. And while it's a very personal illness with these deep biological roots we've talked about, it's also happening in a world that often screams at us that our appearance is more important than our well-being. So that leaves us with a bigger question to think about, right? Beyond the clinic, what can we, as a culture, do to help heal that divide?